Hey, it's Justin Harvey. Thanks for tuning into the Anesthesia and Pain Management Success podcast. With APM Success, we take a close look at important topics pertaining to business, practice management, personal finance, and careers for anesthesiologists and pain management physicians. We work hard to take your critical questions straight to the experts. Thanks for listening. Hello and welcome to another episode of Anesthesia and Pain Management Success. I'm very excited to be joined today by Dr. Jennifer Xiong. Dr. Xiong is a pain management physician. She's in Atlanta. She's a proud product of the Harvard Pain Program, and I actually met her there a few years ago. And I'm excited to talk to her today about career transitions, thinking about the future, and trying to understand, especially with that first attending role, what to observe about different prospective practices, how to know yourself and what you're looking for, and all the stuff that comes with that. So, Dr. Xiong, thank you for joining us today.
My gosh, thank you so much for having me, Justin. It's truly an honor. I feel like it's full circle now being on this podcast, especially since you were such an invaluable resource for me as I was embarking on this process. And you mentioned you spoke to my fellowship class, so it's wild to be here in front of you and on the opposite side of the screen. So thank you for having me. It's quite the honor.
Yeah, so for our listeners, and today's conversation is going to be focused especially on the residents and fellows. So if you've been attending for 14 years, bear with us. Maybe this isn't exactly cut out for you, but it's one of the things I love to do with my work and my platform is to help prevent those first couple big decisions that physicians make to keep you from falling on your face by getting as much intel for like what's on the other side of that decision, on the other side of that first attending role. So for you, Dr. Xiong, talk about how you were thinking about your career and what you knew of it and like what you knew of your specialty as an anesthesia resident and then as a pain fellow, and kind of what were you hoping for and moving towards in those early days?
Yeah. So, honestly, as an anesthesia resident starting out, I never anticipated actually going into pain management. So, I feel like you have heard of this phrase before since your wife is an anesthesiologist, but there is this running joke amongst anesthesiologists that we prefer our patients asleep. And that's certainly the mindset and background that I had going into my first required pain rotation as a CA2 resident. And what surprised me about that rotation was that actually I very surprisingly enjoyed the experience, even though I did not expect to at all. I was expecting to just go through the rotation and meet all the requirements and continue on and possibly eventually just go out into practice as a general anesthesiologist. So it was actually a little bit stressful for me how much I enjoyed the rotation because I had that rotation later on in my CA2 year. So that meant, okay, now if I really do like this, I kind of have to scramble and get my stuff together and figure
Yeah.
out how I put together a appropriate application to match into pain fellowship. So I went through that entire process and jumped on some research projects and found letter writers to eventually match very happily at my same program in Boston. But that was kind of a wild ride actually getting into pain. And I'll say what I saw from that pain rotation as a resident that really spoke to me was one, there is a lot of autonomy that you get in practicing pain that you may not necessarily achieve in anesthesia. There's a different level of flexibility that you have in adjusting your own schedule and also some of the patients that you see. You are less so beholden to the OR cases of that day. You're less beholden to whoever the floor runner is for that day. And certainly on that end, that flexibility and autonomy and how you practice did speak to me. I also really enjoyed and thought all the procedures were really cool and gratifying. And I enjoyed seeing patients that I may have encountered before earlier in the month and maybe helped with a procedure for doing better and functioning better. And that to me was something that I missed a little bit in the anesthesia space. So all of those things together, they caused me to embark on this journey, and where I'm at today.
Did you have any early either patient experiences or mentorship experiences that really solidified that for you?
Gosh, yeah, I would say the one of the big mentorship experiences that come to mind would be one of our beloved attendings at Brigham and Women's Hospital, Dr. Xiong, who is such an advocate for the pain fellows. Uh, Very early on, he gets you into the nitty-gritty. He gets your hands dirty. He brings you into cases and really, really cares about teaching and making sure that you're understanding exactly what's going on. And I understand certainly in a busy academic space, it's not easy to be able to pause and have that conversation and have that teaching discussion with your fellows. And that meant the world to me, and that really influenced my decision to go into this pain space.
As you were then thinking about honing your pain skills and then transitioning to attendinghood in pain management, it's the bulk of the jobs I think are private practice, and there are varying levels of preparedness. I have heard. I have no clinical experience, but there are varying levels of preparedness that one achieves for private practice land based on where they train. So,
Mhm.
talk a little bit about kind of how you were thinking about the future and the mindset during your fellow year and any decisions you made to try to position yourself for success there.
Yeah, so that's a great question. And I feel very lucky that the fellowship program that I was at was high volume. It was a busy fellowship program. And it wasn't only high volume, but it was high complexity in terms of the patients that we saw day to day. And the volume at which we saw patients was pretty much private practice level. So, many fellows coming out of the program that I went to would say that that fellowship experience prepares you for a career in private practice if that's what you should choose to do. Certainly not everybody does that, but if you wanted to, you would be well prepared for that because of that experience. So I felt lucky in that I wasn't necessarily nervous about that transition to eventually private practice because we got so many reps in of not only bread and butter situations, but also complex cases as well. So I'm very, very grateful for that.
I would imagine that in spite of that, there is no perfect preparation. And there's probably you walk in to that first attending job on your first day. And I want to talk about that transition, but you walk in there and
Mhm.
there it is a different ball game. So are there any things that stood out or it's like, I feel well prepared to deal with the complexity, to deal with the volume, but there's maybe this other area that there's just no way I could have known.
Oh my gosh, absolutely. So the whole other area that I could have never known or never been completely prepared for was the non-clinical side of being in private practice. And that's just something that, understandably so, you don't really get much exposure to while you're in fellowship because it's important that you get trained to practice and have good clinical skills going out into the world. But it's this other side of practicing, the business side of being in medicine, the dealing with the insurance landscape, dealing with denials, prior auths, peer to peers, uh, figuring out referral sources, networking, all of those things that are non-clinical. That was what felt like drinking out of a fire hose for me. So I feel grateful that I was at a fellowship that trained me well to feel comfortable with the clinical side of medicine because at least that allowed me to free up bandwidth to focus on this other fire hose of non-clinical information.
As you're getting into your fellow year and you're starting to consider what's next, did you have an idea in your mind of either geographically or clinically, like practice size, small group, regional group, national group, hospital based, smaller clinic where you have full autonomy? Like, what was the profile of the different offers you were considering and what was most important to you at that time?
Hmm. Good question. So My husband, he's also a physician. So the two of us were looking for jobs together. And we knew one of the top priorities was to be at least close to one set of family. So that was either between Columbus, Ohio or Atlanta, Georgia. So that helped to at least narrow some of our job search. And both of us knew that we had an appetite for entrepreneurship and were curious about the space of entrepreneurship. So that helped us focus on private practices. And when it came to assessing these different practices, things that I didn't want to feel like was being a cog in a wheel, and just kind of being someone that churned patients out in and out the door. I didn't want to feel like I wasn't a valued member of the team. And I mean, those are all things that add to a practice's culture. So I guess that's to say that culture was really important to me. And certainly you can find a healthy culture in big practices and small practices. It all depends on the leadership of the practice. So that defined some of my search. And another thing that I was looking for also in practice as I was going out for the job search was, now I'm going to give a trigger warning to if there's any older generation physicians that happen to be listening to this episode who don't need to be listening to this episode. I was looking for work-life balance. All right. And I'll admit that. That's something that mattered to me. It's something that mattered to my husband, and it still does to this day. And that wasn't something that I necessarily felt super strongly for before in the past. You know, we go through this entire experience through medical school, residency, fellowship with just kind of nose to the ground, grinding it out and being okay with that. And because there's no other choice. And I think if I didn't have certain experiences in my residency that forced me to really step back and take stock of what my values are and what my priorities are, maybe I would have continued to carry on that grind without necessarily pausing and taking space to recognize I do want to have balance. I do want to enjoy my life outside of work because if in order to be there for your patients and give your all, you also have to have a full cup. I will add that, in residency, when my husband Jordan and I were both residents, we experienced an incredibly stressful, almost possibly life altering diagnosis that my husband received in the peak of COVID. And we were so scared about what was going to happen. What was the prognosis? How many years do we have left? And thank God he is okay and everything is stable and in remission now. But that incredibly scary and life-altering experience really shaped the way that both of us approach our priorities and our values and how we want to live our lives because you never know how much time you're going to have left on this world. You don't know if it's going to be 40, 50 years, or if it's going to be 5 years or even 1 year. So, um, really recognizing that also played a role in what we want to do with our lives, and that includes work.
You mentioned culture and the culture of the practice you're going to join being very important. I think this is very astute and great guidance, but also very difficult to discern, especially from afar. I mean, if you're interviewing like virtually, even if you're going to show up and like shadow for a day and talk to some of the stuff, like culture is, it's a lot of things. Sometimes it can be perceived in a time span as short as a site visit for a couple days. Sometimes it's like you need to be embedded with these people until something goes wrong or there's a stressful situation and you see like what is the teamwork like? What is the are people kind? Do people support one another? Do people cover for one another if there's, staffing shortage or things like that? So what was your journey of trying to discern the culture of the places you were looking at, and were there any in particular experiences that stood out to you?
Yeah. So, on the topic of culture, I would say as you're embarking on this interview journey, do as much as you can, as much as you possibly can, to speak with any and everyone involved in the practice. Not only other providers, but practice managers, other staff members involved in that space. You want to talk to the most recent hire. You want to talk to maybe if somebody recently left. You want to talk to all of the people. You want to talk to who has been there for 10 years. Each of those opinions matter. And if they don't allow you to talk to some of these people, then that's also something that's suspicious as well. I will say that in my journey, I was very, very lucky and fortunate to have been in a network where my mentors at Brigham connected me with my current partner in my practice and my boss, Dr. Zwade Marshall. He was a fellow Brigham alumni. He, like me, graduated from the anesthesia residency as well as the fellowship program, and had gone out into the world many years before me. But because of that network and because of those shared mentors, that connection was easy. And it was easy to have a dialogue with him. And he brought me into the practice to see how everything worked. He had recently started his own practice, so it was a much smaller practice compared to a lot of these practices that you see out there. But it was growing significantly. And in terms of trying to get a sense of what culture looked like at that practice, I the challenge in his scenario was that he was the only MD there, right? So there's no getting other information from a different hire or somebody who's left. It's everything, you're taking his word for face value. But of course, he had me chat and ask questions to everyone else that was involved from all the other staff, the office coordinators, the MAs, the APPs. So he wanted to make it as transparent as possible. And beyond that, I will say that word of mouth, so the words of our shared mentors and people who knew him prior to him graduating, that went so incredibly far. So, you can only get so much information when you're interviewing at these places and just like you said, seeing them for one day and getting this super visual facade, maybe. But if you talk to people who know what that practice or that person is like behind closed doors, that says enough, say. And in this case, it was all great things.
That's awesome, and there's definitely some reciprocal wisdom. So not only for you in getting in and wanting to talk to all up and down the org chart, but it sounds like Dr. Marshall, shout out to Dr. Marshall, friend of the show, uh, saw a value in the same thing and wanted you to have those conversations. Probably, for the same reasons that you're trying to discern culture, he's trying to figure out, is this person a cultural fit? Like if you
Hmm.
treat other people not well who are, lower down the org chart, uh, is that what is that going to do? Especially as you're the second physician, you're going to be a de facto leader, and if you show up on day one and you're, um, not being nice to the other kids in the
Right.
sandbox, then it's just things aren't going to go very far. So as you were, quantifying as many variables as you could in advance, and it's funny, Dr. Grider, Jay Grider, who's a guy I've enjoyed talking to a little bit over the years, out of University of Kentucky, has this description of finding that first job is like it's basically like trying to find and marry someone in 6 months, starting from scratch, and like you figure out as much as you can, but ultimately you just commit, you hope for the best, and you're inevitably going to find out a lot of things after the commitment, and then you got to work through it if it's gonna last. So in terms of the things that you discovered or maybe surprised you after you accepted the job, what comes to mind?
Hmm. Things that I discovered and surprised me after starting the job. I think this speaks to Dr. Marshall's leadership is how quickly he placed his trust in me to be a leader in the practice. You know, I can totally understand somebody, in his shoes, starting your own practice, that's your baby, right? And to hire a new MD, that is a huge risk. So there's risk on both sides. And I can totally understand that nervousness associated with that. And really early on, he basically told me that he values my opinion and how I want to see changes in the practice. And he said he's not prescriptive about how he wants to be a leader in the practice. And that was really meaningful to me because it showed that one, he trusted me to voice my opinions, and two, he valued my opinions. And that gave me confidence to speak up when I noticed certain things maybe could be optimized. So I think it's maybe this Jedi leadership trick that they do where you show that you trust them. So that builds their confidence to be able to further participate in the growth and the optimization of this space.
Mhm. What are some of the as you were getting in and becoming productive and getting your sort of ironing out the wrinkles, figuring out the workflows, getting the hang of the EMR and all that? What are some of the those early workflows or processes or staff encounters or things that you perhaps saw room to optimize?
Yeah, so a couple of months in, as I was starting to build volume and see more and more patients, something that I started to notice was that my patients, and actually not only my patients, but patients across the board, were spending a while, not only in the waiting room, but even in the clinic room, being triaged before they actually got to see me or another provider. So I was starting to inquire what was taking so long. Why is it, patients don't like waiting this long to see their provider. And it's natural in an instance like this to allocate blame, right? Oh, maybe it's the front desk. They're taking too long to check the patient in, or maybe it's the MA. They're not rooming the patient soon enough, or maybe they're taking too long to triage. But in this instance, I was reminded of a quote, and I am definitely paraphrasing this, but it's something along the lines of every system is designed to produce its results exactly as it is, or something like that, where when there's an issue, when there's a problem operationally, it's very likely a systems-based issue, and it just takes diving deep into the operations to figure out what's going on. It's not one person that's failing the system. If somebody's not doing something that's productive to the operations, then that means there's a systems issue. So in this instance, I started by interviewing each of the stakeholders from front office all the way to when the patient gets room to when the provider sees the patient, and inquired, what do you feel like, to each of these members, what do you feel like is taking a long time? Is the patient spending a long time on paperwork? Are they spending a long time waiting there with nothing to do? Is it taking a while for us to triage these patients? And I also looked into a lot of the paperwork that we have, as well as these documents that we have in our electronic medical record, and triaging questions that the MAs were doing when they were in the room with the patients. And what I ended up finding was that our patients, uh, especially new patients, when they first arrive, they receive an iPad that has them go through a series of questions, and not only confirming, medical history, medications, but a series of triaging questions that ask them to describe their pain from, chronicity to what makes it worse to all the things they've tried, XYZ. It's an extensive list of questions. And that, in that iPad, that document gets pulled somewhere into their electronic medical record to some place that nobody knows where it goes, into some sort of limbo. Nobody ever looks at it. And these patients will be in the waiting room filling out this paperwork, and especially if they're older and not don't have that technological finesse, might take 20 minutes or 20 minutes plus 30 minutes to fill out this iPad paperwork for a document that's maybe nobody's even looking at. And that delays that patient from getting roomed. And then what we found out as well as a next step after the MAs do room this patient, the MAs were going through a lot of these same questions to document it into the chart, thus creating duplicative work, all this redundancy that was adding so much extra time to the patient encounter before the patient's even ready for a provider to see them. So just this simple removal of redundant work saved significant amount of time. So that was something that I'm happy to have found because that has caused a decrease in wait times for our patients.
Awesome. I love squishing bugs and processes. That's a personal passion of mine. So that sounds really fun. As you look back on this journey, is there anything that, especially as you were a fellow and you're trying to gather information and seeking input from mentors and everything, that you kind of thought was really important, you thought was going to be a big deal, and turned out it was just a total red herring and not that big of a deal? Don't even worry about that.
Hmm. Yeah. So I guess one thing that comes to mind is a challenging experience that I had early on as a new early career physician, about 6 months out into practice. And to start the story, I'll preface by saying that uh, I am a rule follower. I never break rules. I've never gotten in trouble before, as far back as I can remember. So this experience was really scary for me. But I do want to share it because I want other early career physicians and current and future fellows to know that this is something that can happen and is a normal thing that can happen in this space, and it will be okay. And you're not the only one. So, about 6 months into practicing, still green, early career physician, I was at home when my husband Jordan, he brought in the mail. And in that stack of mail, there was a letter addressed to me, Dr. Jennifer Xiong, that was from the Georgia Composite Medical Board, and it had all the professional stamping and whatnot. It looked very official. And when I saw that, my initial instinct was, okay, am I due to have some certification updated? Do I need to renew something with my license? So I very casually opened that envelope, and inside there's 3 sheets of paper. And when I looked at that first sheet of paper, my heart dropped. And what I saw on that paper was a notification from the Georgia Composite Medical Board that I was being investigated. I was under formal investigation due to a formal complaint filed by a patient that I had seen in the practice. And in that moment, I was absolutely stunned. I think time and space just stopped entirely for 30 seconds. And then after those 30 seconds, all these scary, nerve-wracking thoughts come crashing in. Like, what did I do? What happened? Who is this patient? Am I gonna lose my job? And am I gonna lose my license? And I flipped to the next page, and on that second page, there was a letter from the attorney representing the Georgia Composite Medical Board. And it was a subpoena requesting all of the documents related to this patient. And not only all the documents from our EMR related to this patient, but also requesting a written response from me describing all the details of this event. And the event in question was that a procedure that I had performed on a patient made this patient's pain worse. So throughout all of this, I, of course, went to the computer, logged into the EMR, and looked up this patient and looked up this encounter. And it was a patient that I had actually only ever seen once in the practice. It was a patient that had been seen by somebody else and teed up for me to perform this one procedure, as it was a repeat procedure. And then they were later followed up with an APP in our practice. And digging through all of the notes, what confused me and did not give me any closure was that all the notes seemed copacetic. So there was nothing in that procedure note that told me there was anything that was off kilter or anything that was abnormal about the procedure. And even the next day, all of our patients, they get a phone call from one of our MAs checking in on them and seeing how they're feeling. And on that encounter, the patient, at least in that note, reported they were doing well. And then in that post-procedure follow-up visit with our APP in the practice, it was the same thing. That it was documented that the patient was doing well after the procedure. And after that, that patient was lost to follow up. They never came back, and our practice tried to reach out to the patient and to no avail. So it was just always a mystery what exactly happened and why. I never got closure on why they were dissatisfied with that experience. But beyond that, after submitting all of these things and writing a detailed response to the board, eventually the board got back to us and said, cleared everything and, agreed that this was something that didn't need to have any further investigation and the case was entirely closed. But you can imagine, as somebody just 6 months out into their career, receiving a letter like this, how jarring and unsettling that was. And, early in this first year, you're still building your confidence as a clinician. And that just rocked me to my core. But in retrospect, I am glad that that happened because everything was okay, right? And one, it showed me that this is just the nature of medicine and the space that we're practicing in. And there's no avoiding something like this. You can do everything perfectly. You can practice the standard of care, and something like this can still happen to you. And I'm sure everybody, either themselves or knows somebody that something like this or something adjacent to this has happened to them. And understanding that early, and at least knowing how to do your best to document appropriately to protect yourself as much as you can is important to learn early on. And in this case, there were no consequences from that. And I'll say the second part of this experience that I took away from it was that it showed me that the culture of my practice is genuine and pure. So the next day after I got this letter, my boss, my friend, my partner in the practice, Dr. Zwade Marshall, he was actually on vacation with his family in Europe. So he wasn't supposed to be doing any work stuff, but he had heard from our practice manager that this is what happened. And he called me in the middle of the day while he was on vacation to let me know, do not worry about this. This is not on you. Let the practice handle this. We will take care of all of this paperwork and we got you. And I think that just speaks so much to being a part of a practice where the culture is pure and authentic. And that gesture has stuck with me to this very day.
Thank you for sharing that story. How do you think that has changed your perspective or your practice or the way you think about patient encounters or any of that?
I think that it has added more equanimity in the way that I practice because it's like that parable, good or bad, who knows, right? If you never know whatever happens in life, if it's truly a good or if it's truly a bad thing. And these types of and understanding quickly and early on that these types of things can happen. And as long as you know that you have practice with a true moral compass and you've practiced ethically, then you will be fine and you can get through these challenging things. But still, it's important to understand that this is something that can happen, and you can't be naive to the fact that this is something that does happen.
As we're wrapping up, as you think about the time now that you've been in attending, the important career decisions and transitions that you've made, the times you've been out of your comfort zone, taking that step of faith in certain contexts, tell me a part of your journey that you're proud of as you reflect on it?
Yeah, I would say I'm most proud of just stepping into this leadership role in the practice. It's certainly, coming into a new practice, being the new kid in town, it's you want to find a balance in the way that you make suggestions and make changes in a place that is already really comfortable with what they have. And coming in, you can't be, guns a-blazing and commanding this and commanding that. It really, really takes experience, and that built up experience that leads to trust, which leads to respect.
Mm-hmm.
And I feel really fortunate that in the practice that I'm at, there's just a lot of mutual respect now. And we recognize that we're all on the same team. We're all trying to navigate this landscape together. We're trying to figure out the insurance changes together. And whatever happens throughout the day, or week to week, if there are challenges that we encounter as a team, we know that at least amongst our team members, the intent is good, right? And we're all on the same team.
That's excellent. Thank you, Dr. Xiong, for joining us. It's been a pleasure chatting with you today on APM Success.
Thank you so much, Justin. It's been a delight.
If you liked what you heard this week, head on over to apmsuccess.com, where you can find more content and free resources to help you build a successful career in anesthesia and pain management. If you wanted to leave a review in iTunes, I'd also really appreciate it. Thanks for using some of your valuable time to join me today on APM Success.